Now, live from Studio 550, this is The McGraw Show on KTRS.
Jane Dueker is with us, former chief of staff to Governor Holden, yes, a Democrat, and she says that publicly. She's also a lawyer with Stinson, Morrison, and Hecker. She's here to talk about health care, Medicare expansion, and all that. You've explained to me the difference between Highway 70 insurance and the rest of the state's insurance. Explain that.
Well, and Missouri is sort of unique, and a lot of people will say archaic because we have two different Medicaid systems in Missouri. We have the I-70 corridor, which would be Kansas City, and it's exactly what it means. All along Highway 70, Kansas City, Mid-Missouri, Columbia, and St. Louis are all on a managed care system.
Which means?
Which means it's very similar to what you already have. You have a company, you have one company, and they have a network, and you go get your health care, and you stay in your network, and there's certain benefits that are provided. And so it's how we all sort of normally live.
Okay.
Now, in the rest of the state, though, we have fee-for-service, which is, you go to the doctor or you go to a healthcare clinic or whatever, and they take care of you, and then the doctor goes to Medicaid, and they get a fee for that service. And so it is a lot of people will tell you managed care saves money because it coordinates care, and you have a general practitioner or someone at least deciding, hey, let's go, send you to a specialist, or you don't have to go to a specialist. Whereas fee-for-service, if that care is not coordinated, some people will say that can be more expensive.
The argument is that the Medicaid expansion, we keep hearing this, the Medicaid expansion, or excuse me, the Medicaid reimbursement isn't what the doctors want. And so, therefore, the doctors will, in turn, reject patients because it's not worth it to them to see them.
Correct. I mean, and that's a separate issue. And so the issue of fee-for-service versus managed care is actually separate from the Medicaid expansion debate, okay?
All right.
The difference between fee-for-service and managed care, that issue exists whether we expand or not. It's just a delivery system. And is one more efficient than the other? Will one save money? Now, in Missouri, we have a managed care system, but a lot of parts of the healthcare system are exempted from that. So pharmacy is exempted from managed care, or nursing home care is exempted, or mental health services. So the more you exempt, the theory is that you can't coordinate care as well, which means you won't realize the savings and the efficiencies that you might want to see.
Why are those things exempt?
Because they have interests and
because they
groups.
have good lobbies that they don't want to be in.
Basically, yeah. Basically, yes. And I think, and when you talk about the reimbursement issue, I think Missouri does not reimburse doctors enough. And it could get to a point where we have access issues if enough doctors say can't do it. And so my theory has been, let's get the expansion, let's get the more healthcare dollars, and then maybe we can reimburse doctors better and increase their desire to stay on Medicaid, or get more people insured so that doctors will take their care.
So if somebody's in a business outside of the I-70 corridor, okay, and they are working for a company and they have to go to the doctor,
and they don't have insurance through their employer.
Right.
Okay. Because it's a small company, or they're not required to.
Right. Okay. First of all, if they have insurance through their company, they go to their managed plan.
Correct. Generally, most of them are managed care, but
right,
yeah.
Right. If you don't have health insurance and you live outside of the 70 corridor, you go see a doctor, that doctor gets reimbursed.
If you actually qualify for Medicaid, which means
qualify for Medicaid,
you can only make, if family of 3 in Missouri, if you're a working dad and you have a wife and a kid,
right,
you can only take in $292 a month to qualify for Medicaid.
This is the poorest of the poor.
Correct.
Okay.
And so they qualify for Medicaid, they go to the doctor, and then the doctor gets reimbursed at a Medicaid rate.
If you don't qualify, if you make too much to qualify for Medicaid,
meaning you make $300 a month.
Make $300 a month or more, and you don't have health insurance.
Correct.
You still go to the doctor.
Correct.
We then pick that up.
Generally, yeah, the cost will be shared among the insured population because the hospital has to provide the care, which means uncompensated care means they charge the insured population more money than they otherwise.
So we're paying for the indigent under $300 a month.
Correct.
We're paying for the people over $300 a month.
Correct.
All the way up to actually until they're eventually then insured by either themselves when they choose to, or when they get into a company in which helps pay for their health insurance.
Correct. And it's not very efficient to do it that way. It's cheaper to just cover them all under Medicaid. It's a heck of a lot cheaper to pay, for example, in Missouri, our kids, $100 general revenue, $300 federal money. That insures a kid for an entire year. Okay, that's $400.
Right.
$100 of it is general revenue, which a lot of which is subsidized by hospital taxes. So you insure them for a whole year. They go to the emergency room once for strep throat. You're spending thousands of dollars, and you're spreading that cost among the insured. It's obviously much cheaper to just put them on Medicaid, and your tax dollars will go up a lot less than your insurance premiums.
They say the argument in Jefferson City is 137% of the poverty line.
138, which is what the feds want.
The feds want people covered by Medicaid up to 138% of the poverty line.
Correct.
Which is, do we know how much that is?
Oh, I'd have to look.
I
should know that off my head.
It's like $15,000 a year or something for a family of four.
If that,
it's something.
Yeah, it's really poor still.
But the argument is that they don't want it to be 138, right? So Tim Jones and the House are saying, well, maybe it should be 100. Maybe it should be, 98. Maybe it should be 95. Maybe it should be 120, not 138. And so they're arguing over this percentage of what number should be covered by Medicaid, right?
Correct.
Okay. And the feds have said, if it's not 138%, you get nothing, right? So far.
So far, that's what they've said. Correct.
Okay. But the argument is whether or not it's 100% of the poverty line or 98% or 120% or this 138%. The people who aren't covered still go to the hospital.
Yes, they still get care.
And somebody still has to pay for them.
Correct. And they're usually sicker. By the time an uninsured person, they don't go to the doctor, they don't do prevention, they don't go get their blood tests to see if their cholesterol's too high or do the sort of things that a lot of people would normally do to prevent major illnesses. By the time they get to the doctor, they're the sickest of the sick as well. So now you got the poorest of the poor, the sickest of the sick going to hospitals to get traditional general care.
Right. So whereas,
it's going to be more expensive.
Whereas if there's a governmental program where it says everyone who makes under $10,000 a year is allowed shoes, okay?
Mm-hmm.
After that money, you don't get any shoes, or you put a limit on the amount of historic tax credits, right? After you reach $100 million in tax credits, you don't get any more tax credits. We don't then pay for people's tax credits from another fund, right?
Right.
So in this instance, they're arguing over what percentage to cover people who through the poverty level. But even if you're above that level they agree upon, we're still paying for their health insurance.
You're just paying more. You're not even paying for their insurance. You're paying for their health care. And insurance is always cheaper than just paying for out of your pocket, or nobody would get insurance.
Right. So when Tim Jones was on this very station with Rick Edlin last week saying that basically he's not going to pay for these deadbeats who aren't.
The deadbeats. See, that's right there. You've just, in my opinion, the misnomer here is Medicaid's not for the deadbeats. It's for us insured people. It helps us more than it helps them.
Explain that.
They're going to get their health care. Like you said, we don't let people die in emergency rooms. They're going to get their health care. They're going to wait too long. But Medicaid is for us to keep our premiums from shooting up 30% a year. That's who really it's protecting. It's protecting the healthcare system and the insured population, not the deadbeats. And so that's, it rolls into this debate of, this is, entitlements. And, I understand that's real easy. But when you look at the facts of the situation, the facts aren't going to change. These people are still going to go get their health care. It's just a matter of how much we're going to pay for it.
We've already entitled everybody to hospital care.
Exactly.
Everybody has
acute care.
Right.
Correct.
Everybody has already got it.
Correct.
So the argument is, how do we do it cheaper?
Correct. And that's what's frustrating to me is, so if you want to argue that we don't want to do that at a federal level,
right,
then go to Congress. Tim Jones, get elected to Congress, win the House, win the Senate, win the presidency,
right,
and overturn this. If you don't want the government doing this, but it's the law. So now as Missourians, what are we going to demand? And you'll see that without, with little exception, there are very few people who understand the full debate here and understand the efficiency and the financials of this that have disputed we ought to expand.
Which is why I have a list in front of me of 50 chambers of commerce throughout the state who are in favor of this.
Including the Missouri Chamber, including, statewide organizations. And the brilliant Andrew has told me that 138% of poverty for a family of four is if they make $31,000.
$31,000.
Correct.
But again, his comment of he's not going to have all these deadbeats
on care.
Getting this government care. They're not getting government care. They're getting our care.
Correct.
We're paying for their care.
So when you go to the emergency room and you wait in line for 4 hours because everybody with the flu is sitting next to you,
right?
Instead of going to a doctor and going to a general practitioner, they're going to the emergency room. So it's not just money; it's also access to care.
That's Jane Dueker. She is former chief of staff of Governor Holden. She's an attorney, and she's also our health insurance expert here on the show. We'll take a couple phone calls. 314-969-KTRS, 1-888-550-KTRS, or star KTRS. If you have a question, pro or con, we'll take them all. We'll come back next and talk more with Jane Dueker here on the Big 550 KTRS.